Good afternoon, everybody, and happy Nurses Week. My name is Beth Oliver, and I'm the Chief Nurse Executive and the Senior Vice President of Cardiac Services for the Mount Sinai Health System. I'd like to take this time to wish you all a very happy Nurses Week. And to begin, before we kick off our keynote speaker, we have a message from Dr. Ken Davis, our Chief Executive Officer for the Mount Sinai Health System, who will be sharing a brief message.
Good afternoon, and thank you all for joining us today. It's my pleasure to be with everyone, both in person and tuning in virtually, to kick off Nurses Week in celebration of our more than 8,000 extraordinary nurses at Mount Sinai. Your dedication to our patients is what makes Mount Sinai great. That dedication has shown through more than ever over the past 2 years. You have cared for our patients through unprecedented challenges and provided them with extraordinary care amid uncertainty, patient surges, and staff shortages. We can't thank you enough for stepping up to provide care outside your typical units, beyond your typical hours, and under anything but typical circumstances. In the most difficult of times, you have remained dedicated healthcare providers, trusted advocates, and inspiring leaders. This week and every week, we're immensely grateful for your contributions to our patients' care and to our community. Today, we're thrilled to have Dr. Ernest Grant with us. As president of the American Nurses Association, he is a very busy man. It's an immense honor that he's taken the time to join us. It speaks to how extraordinary you all are and how deeply the nursing community values your contributions to the field. Dr. Grant is a leader in diversity, equity, and inclusion, and a prominent voice on the pandemic. Today, he'll tell us about what he's been seeing across the country, speak to the importance of diversity, equity, and inclusion in nursing, and share some of the American Nurses Association's key initiatives and advocacy efforts. Thank you, Dr. Grant, for joining us. Now I'll turn to Beth Oliver to introduce Dr. Grant.
So I am so thrilled. It's my privilege to introduce our keynote speaker, Dr. Ernest Grant, President of the American Nurses Association. Dr. Grant is the 36th president of the ANA, the nation's largest nursing organization, representing the interests of the nation's 4.2 million registered nurses. A distinguished leader, Dr. Grant has more than 30 years of nursing experience and is an internationally recognized burn care and fire safety expert. He previously served as the burn outreach coordinator for the North Carolina J.C. Burn Center at the University of North Carolina Hospitals in Chapel Hill. Dr. Grant also serves as adjunct faculty for the UNC Chapel Hill School of Nursing, where he works with undergraduate and graduate nursing students in the classroom as well as clinical settings. Dr. Grant is frequently sought out for his expertise as a clinician and educator. In addition to being a prolific speaker, he has conducted numerous burn education courses with various branches of the U.S. military in preparation for troops deployments to Iraq and Afghanistan. In 2002, President George W. Bush presented Dr. Grant with Nurse of the Year Award for his work in treating burn victims from the World Trade Center site. In 2013, Dr. Grant received the B.T. Fowler Lifetime Achievement Award from the North Carolina Fire and Life Safety Education Council for making a difference in preventing the devastating effects of fire and burn injuries and deaths within the state. Dr. Grant is an active participant of many professional organizations, including past chair of the National Fire Protection Association Board of Directors and served as second vice president of the American Burn Association Board of Trustees. Dr. Grant also served as president of the North Carolina Nurses Association from 2009 to 2011, and in 2002, ANA honored Dr. Grant with the Honorary Nurse Practice Award for his contributions to the advancement of nursing practice through strength of character, commitment, and competence. Dr. Grant holds a BSN from North Carolina Central University and an MSN and PhD degrees from the University of North Carolina at Greensboro. He was inducted as a fellow into the American Academy of Nursing in 2014. He is the first man to be elected to the office of President of the American Nurses Association. Please join me in welcoming Dr. Grant.
Thank you, Beth. Good afternoon. Hey, I was up at 3 a.m. this morning, and and it could be the 2 or 3 cups of coffee that I had. So let's try that one more time. Good afternoon. Good afternoon. Okay, you are awake out there. Great, great. Glad to hear that. I can't tell you what indeed an honor and pleasure it is to be here with you. This was about a year in the making. I gave the keynote last year virtually, and there's nothing like being here in person. So I do want to thank Beth for extending the invitation to come back this year. Of course, the fact that she promised me a wonderful seafood dinner sort of had a little bit to do with that as well. But nonetheless, we are here, and I can't think of a better place to be than to share it with my fellow colleagues and to help you celebrate not only National Nurses Week, but also National Nurses Month, and talk about how, as the slide says there, you make a difference. So with that, we'll go ahead and get started. Just a little bit, first of all, about who we are at ANA. Some of you may have heard of us, some of you may not, and some of you may have not heard about the ANA Enterprise. So let me tell you a little bit about that. So the Enterprise is the family of the organizations there: ANA, the American Nurses Foundation, and ANCC. If you've been certified in some form or fashion as a nurse, or if you are a magnet, that's what ANCC does. But the 3 organizations work together as one cohesive system to achieve the enterprise vision, to advance our mission, and to embody the enterprise's value as well. And so we leverage those 3, each of these, to drive excellence in practice and to ensure that nurses' voice and visions are recognized by policy leaders, by the industry itself, and by employers. So from professional development and advocacy to credentialing and grants, and the enterprise is the leading resource for nurses to turn to. And we know that in helping individual nurses to succeed across all practice and specialties, and at each stage in their career, that the enterprise is lighting the way for the entire profession of nursing as well. Now, how we do that? Well, we have a vision statement that is a healthy world through the power of nursing. Our mission statement is to lead the profession to shape the future of nursing and healthcare. And our goals is to elevate the profession of nursing globally. And you can't say that over the past 2+ years that that hasn't been achieved. To engage all nurses to ensure professional success, to elevate the practice of nurses to transform healthcare, which we are boldly embarking upon, and to enable the transformational capabilities through operational excellence as well. And let's not forget about the values that we hold forth as well: trusted, inclusive, innovative, and empowered. As I was walking, doing some of the rounds this morning, and I saw your values, it was posted on, was it 6, 5? I had to take pictures of that wall, so it gave me an idea, and I'm going to share that as I continue my talks around the country to get other people to do that as well. I was very well taken by the wall of commitment, where nurses will sign their names as part of that. I really like that idea. But just a few words about ANA itself, who we are and what we do. As was mentioned, we're the premier organizations for the nation's 4.3 million registered nurses instead of 4.2. We're at the forefront of improving healthcare for all, and our core functions are advocacy and professional development. But our membership has been one of the fastest growing over the past 5 years, and actually over the past few years has put us in the top 9% of associations for membership growth. And actually one benchmarking study shows that ANA is the #1 fastest growing large association among individual members associations over the past 5 years. And of course, we have experienced even more as more nurses turn to ANA for resources during the COVID-19 pandemic. But we can't do that alone, obviously, as with our 50 state and organizational affiliates that also, we have 39 organizational affiliates, 50 state associations, and working together, we all push forth ANA's, the nursing agenda, not just ANA's agenda, but the nursing agenda to help promote nursing. Now, I don't have to tell you this. As you know, we are the largest profession. We spend the most time with patients. We're there through thick and thin. We're there when patients are at their most vulnerable, and to shepherd them through that time. As Maya Angelou once said, they may not remember your name, but they will remember what you did for them. And I find that to be very true. And I'm proud to say that for the 20th consecutive year in a row, we have been ranked as the most trusted profession by Gallup's annual Honesty and Ethics poll. And as we know, patients do rely on us to advocate for improvement in healthcare policy, practice, and care as well. But I want to talk to you today about Nurses Month and Nurses Week. This is what brings us together today. I want to start by wishing you all, first of all, a very happy National Nurses Month, and to share some of the exciting things and activities that ANA has planned for this month-long celebration of our profession. This is the third year that we have had National Nurses Month, and extremely happy about that. So while the past 2 years obviously has undoubtedly tested us on so many levels, we have all risen to the challenge and continued to find ways to be more innovative, more flexible, and more persistent. National Nurses Month is intended to recognize and celebrate our profession, especially after everything that we have faced. This month is a time to honor the invaluable contributions of America's registered nurses, which is why ANA selected the evergreen theme of Nurses Make a Difference, because you do make a difference every day. As I told a graduating class last night at the Duke University School of Nursing, I said, you have persevered through 2+ years of a pandemic, once in a century pandemic. As nurses, we can do anything. And I think that is certainly true. This month, we will be facing, divided into 4 weeks with specific areas for each week. There's self-care, which was last week, recognition, which is this week, professional development, and community engagement. So as I mentioned last week, we dedicated to cultivating and maintaining an optimal mental health and well-being as well. This week, we are about recognition. ANA is honoring the work of nurses who lead, excel, and innovate, not only in our healthcare systems, but across our communities, which makes them vital to transforming the future of healthcare. Next week is meant to help guide you in the professional development. Focus on how you will excel and lead in your nursing career, or inspire and help others in their professional nursing journey. And then at the close out the month, we encourage nurses to educate members of the community on what it is that we as nurses do beyond the bedside: advocacy, shaping policy, or serving as organizational board members, among other duties, and encourage them to support the current and future of nurses as well. Our premier professional development activity for next week also is a free live virtual event that's going to be on Wednesday, May 18th at 1. And it is entitled, as you see there, You Make a Difference. And the objectives for this You Make a Difference live nursing event are to, 1, recognize and celebrate the nursing profession; 2, connect through storytelling, as we will be showcasing authentic nursing experiences and inspirational moments that were submitted by nurses from across the country; and then learn how your story can make a difference to improve your community and nursing as well. The reality that nurses are facing today makes storytelling very critical to the profession and for the future of nursing. So sharing your stories with one another is not only empowering, but can be informative, motivating, and healing. So please don't forget to register for this May 18th event. It is free of charge. And please check out nursingmonth.org for more additional information as well as we celebrate. And one of the other things that I wanted to talk with you today is also to talk about some key initiatives that we at ANA are doing as well. ANA firmly believes that advocacy is a strong pillar of nursing. As nurses, we instinctively advocate on behalf of our patients at the bedside and in our communities. But when it comes to legislative and political advocacy, that is no less important to advancing the profession and patient care as well. In fact, ANA has a very rich history of advocacy for more than 120 years. So from women's suffrage to standards for education and practice, to supporting legislation for Medicare, to protecting the economic and general welfare, to shepherding the code of ethics with interpretive statements, to codifying our social policy statement, to creating a nurse credentialing agenda for the nation, ANA has been serving nurses, the public, and the profession. And just to point out a couple of things there on the left-hand side of your screen is then past President Joe Eleanor Elliott with President Johnson at the signing of the public health nursing bill. Out of that bill came Title VIII legislation, which allows for nursing education, funding for nursing education at the undergraduate through graduate level as well. And I'm proud to say that every year since that bill has been was passed, Title VIII legislation has been funded, in some cases not as much as we'd like, but at least has been funded, to ensure that people who want to go to nursing school to get an education can do so. In the middle there is one of our past presidents, Dr. Karen Daly, at the signing of needle stick legislation. And I have no idea who that handsome guy there is with George Bush, but that was my recognition for the work that I've done as a result of 9/11. But as we know, as I stated though, our commitment to advocating on behalf of frontier nurses really became quite evident when that little virus hit our shores in March of 2020. We started out by ensuring that letters and contacting our members of Congress to ensure that aid packages and PPEs and testing and the education that nurses needed and how to take care of a COVID patient was undertaken. We wrote joint letters to the administration requesting emergency funding and suggesting actions and strategies to help combat COVID-19. We issued call to actions where we have our members who have easy access or send them emails to email their congressmen and their senators to talk about things such as APRN authority and the emergency waivers. One of the things that I've been advocating on for the last 3 years is full practice authority for APRNs. And we have it in about 24 of the 50 states. I'd like to get it in all 50 of the states. One of the biggest drawbacks has always been that, well, there's always potential that, some large mistake or something like that would happen. Well, when they issued the emergency statement and allowed full practice authority, we have a wonderful 2+ year experiment, if you will, that allowed, full practice authority. So now we're going back to the table and saying, all those fears that you had, if we perform this well in an emergency, imagine what we can do when that emergency has been lifted. So we will continue that effort. Also talking about the federal response, what needs to be done. We found that obviously the supply chain had, there was lots of kinks in that, as you pretty well know. But when they went to go to the national depository to bring out masks and gowns and gloves and et cetera, and found that they had been dry rotted, someone was not doing their job. So finding out who to hold accountable and to make sure we put measures in place that when the next pandemic occurs, and there will be another pandemic much sooner than a century from now, that we don't encounter the same problems. What are we learning from this pandemic that we can be better prepared for the next one? Immediate use of the Defense Production Act so that, again, the resources that we need are manufactured here in the United States and help to increase the supply chain as well. Securing mental health support. One of the things in May of 2020, I was beginning to, from some of our surveys, I was beginning to get information from nurses that they were burnt out, that they were suffering from not only physical fatigue, but also mental fatigue. And that has only escalated as this pandemic has continued. And so calling that to the attention of our members of Congress so that they can appropriate the appropriate funding so that nurses and other members of the healthcare team can get the appropriate care that they need is extremely important as well. So we continue to monitor regulatory changes in states that impacting nurses as well as as this pandemic looks like it's beginning to subside, but we'll still keep our eyes on things. But again, it is extremely important that we continue to do the work and advocate and be up there on Capitol Hill and also in various state capitals as well to make sure that nurses are getting the resources that they need in order to do the jobs that they need to do. Now, we know too that the pandemic demanded most of our attention, but as an organization, as a profession, and as a nation as a whole over the last 2+ years, however, there are other issues that have required our response and engagement as well. This pandemic has both exacerbated and shined the light on healthcare disparities and racism. This is something that members of the BIPOC community knew existed all along, but there's still that old saying that says shining the light is the best disinfectant. But I like to say that the best moral disinfectant is publicity. So as nurses, we need to continue to stress and address the need for respect, equity, inclusion, and social justice within the healthcare system and within the nursing profession itself. There aren't two separate worlds as nurses that we practice as people, because nurses are people too. And nurses also endure the same positive and pitfalls as members of society. And let's not forget that nurses are also consumers of health and other industries as well. So there's absolutely no protective bubble for nurses as they represent numerous populations and groups. Nurses come from all various backgrounds with various gender and sexual identities, religious denominations, and all walks of life. They also have families and productive members of the communities that they live and work within as well. So when we talk about diversity, equity, and inclusion, or otherwise phrased as DEI, those are concepts that are typically looped together. But these concepts have taken a center stage, obviously, since the murder of George Floyd in May of 2020. And as a result of that, both healthcare and the profession of nursing itself is facing a very hard reckoning. And what do I mean by that? I mean that racism obviously is a longstanding public health crisis that impacts the mental, spiritual, and physical health. COVID-19, as I said, only exacerbated this crisis and added to the stress in the Black and other communities of color, which were experiencing higher rates of infection and deaths. Some of the underlying factors, as you pretty well know, is the disproportionate burden of disease on the social determinants of health, meaning the social and economical factors that contribute to poor access to healthcare or poor health status, including high incidence of chronic diseases such as diabetes and hypertension. So to remain silent is to be complacent. So we must bring health and healthcare. We must begin to address that. And I'm proud to say that during our 2020 membership assembly, the ANA's highest governing body adopted a resolution on racial justice for communities of color. It reaffirmed ANA's position against racism, discrimination, and healthcare disparities. In addition, the resolution also outlines some actions that we at ANA would take along with our constituent and state nurses association and our individual membership division pledged to do. And some of those was to oppose and address all forms of racism and discrimination, to champion the code of ethics for nursing, to partnership with nurses everywhere, to educate, advocate, and collaborate to end systemic racism, particularly within the profession of nursing, to advance the ending of health inequities within communities and healthcare systems that stem from systemic racism. And the list goes on and on. But again, if you want to read all of those, please go to nursingworld.org and find out some additional information there. But as a result of that, I'm proud to say that from that resolution came the formation of the National Commission to Address Racism in Nursing. This commission, when I was calling around to get other members of the nursing community to come in and join with us, one of the things that I told them is that I want you to realize that this will not be ANA's commission. This is everybody's commission. We all are buying into this. And ANA will serve as one of the co-leads, but in order to hear from particularly minority nursing organizations, they had to have a ownership. And so the result of the National Commission was formed. So we're taught, as I said, to treat patients with respect and dignity, regardless of all these identifiers, their culture, their race, religion, et cetera, you name it. But the reality, Ira, is that we have a lot more work to do before we ourselves are a model of diversity, equity, and inclusion. So to start, we need to clean our own house, which we must acknowledge and apologize for the segregation of nurses that nurses were subjected to in the past. And I'm proud to say that next month, during our membership assembly meeting, ANA will be, there is a resolution for a reckoning statement that ANA, the membership assembly will vote on, where ANA will apologize to nurses of color and our Native American nurses for past discrimination that was done to them. So that is the very first start, because how can you have a national commission to address racism in nursing if you're not going to identify the work that you've done in the past? Thank you. Well, I should say the discrimination that you've done in the past, not the work. But as Beth mentioned, I'm the first male to serve as president of ANA. Who knows how old ANA is? 126 years old. I'm only the third African-American to serve as president. So you can see that we have quite a lot of work to do, and we will get there. We will definitely get there. So last fall, as I said, ANA's board of directors voted to convene a steering group to explore racism in nursing. So the National Commission to Address Racism in Nursing emerged. And the commission is led by the American Nurses Association, the National Black Nurses Association, the National Coalition of Ethnic Minority Nurses Associations, and the National Association of Hispanic Nurses. The commission has approved its vision, mission, and goals, as you can see there, and has added a definition of racism. And one of the things I love about this definition is that it is a nursing definition about racism, which I really love. We also realized that we needed some guidance in doing this work. So we hired Dr. G. Rumey Alexander as our scholar in residence to help us to work with this. And as a result, one of the things that we have determined is that we will address racism initially in 4 areas of nursing: nursing education, clinical practice, nursing research, and nursing advocacy. From the education perspective, the approach that we are taking is that when you enter nursing school, that in some roundabout way, it is racism may be taught. You may be reading a textbook which says that people of certain ethnicity have a higher pain tolerance than someone else, or that this group of people views health this way or that way, instead of actually getting to know the individual. So the whole idea from addressing it from an education perspective is that it will eventually drive change in the way nursing textbooks are written, and subsequently drive change in the way the NCLEX exam is written as well, so that people have, when we think about or talk about having more of a holistic approach, do we really do that, or do we look at the individual for who and what they are, as opposed to just automatically classifying that, oh, well, you're from this group, so therefore I was taught in nursing school that your group does this, this, and this when it comes to healthcare. But what about that individual? They may be that outlier, right? So we've got to be able to really address it from the education perspective. From the clinical practice perspective as well, we know that in some certain situations, we have those frequent flyers, right? Those who use the emergency room for their primary care. And in some cases, we begin to get tired of that. And we say, oh no, it's them again, or they're from this zip code, so let's get them in, get them out. Or we know that if a person of color comes in with chest pain and he or she may be quickly told, take Tylenol and go home. You have a white man who comes in with chest pain and he's admitted, gets a full workup, maybe even has stent, And then 4 hours later, that person of color comes in full arrest and, again, not having the same type of treatment. So calling those out and getting nurses to become allies, and questioning why are we treating one different from the other. One of the things that we did prior to launching into these areas was we held listening sessions from around the country. And it would just really pull at your heartstrings to hear the stories that nurses of color told about their nursing education, or how they have to fight just about every day on the floors that they are in because of who they are, because of their ethnicity. And it was really a cathartic event. It really did just pull at your heartstrings. So we know that there is a need for this, to address this. And I'm happy to see our report, which was due to come out yesterday, but unfortunately, due to some delay in printing and et cetera, it will be coming out, I think, on the 23rd of this month. But either way, I urge you to go to our website, nursingworld.org, on the 22nd, 23rd of this month, and look for that first document about racism in nursing. I forgot to put up, there's the timeline that is all the work that we have done. And then in November, we will be having a virtual summit as well. And again, would welcome your participation, because we need to hear from all nurses, not just nurses of color, but we need every nurse out there to come and talk about their experience, talk about what can I do to be a change, because that's the only way that we're going to do this. And if we want this to be a model for other healthcare professions to address, we've got to have some honest conversations. I know in some cases it may make some people uneasy, but once you get past that and become an ally, or be able to to find your voice and to speak up, that is where we're going to begin to make a difference. So I strongly encourage you to please consider joining us. So as I briefly touched on with the previous slide, last month the commission also released a survey from over 5,600 nurses with findings showing that racism is a substantial problem within the profession. More than 3/4 of Black nurses who took this survey, and the survey was taken by nurses of all colors and ethnicity, but 3/4 of the Black nurses who were responding said that racism in the workplace had negatively impacted their well-being. 63% of the nurses surveyed said that they had personally experienced an act of racism in the workplace, with the transgressors being either a peer, a patient, or a manager or supervisor. Can you imagine that? A peer, a patient, a manager, or a supervisor. So we knew that this was happening, but the results of this survey only just validated that. And again, it encourages the commission that to recognize that we have even more work to do. So the commission meets monthly to explore the issues of systemic racism within nursing. And as I said, we will continue to do that. And in the third quarter, we will have the virtual forum on racism in nursing. And we urge all nurses from across the healthcare setting and environment to join us and to have those deep conversations that need to be happening. Also, as I mentioned, the board of directors also begun drafting a statement to apologize for ANA's past actions that contributed to systemic racism within the profession. So this is the start of a very long journey to address the harms while also identifying actions that we will take. And the purpose of this work is for ANA to engage in a process of meaningful reconciliation with its actions that have contributed to perpetuating racism within the nursing profession, to apologize for such actions, and to identify future actions that we will agree to adhere to as a means of ensuring that ANA will be a welcoming space for all nurses and advance the needs of nurses of color. And as I stated, this will be considered and hopefully adopted at our membership assembly next month. And we're having several touch points meetings in between that, but I'm really looking forward to getting this statement out there. I think that would be one of the hallmarks of my term as president within ANA, is to get this reckoning statement out there. Let's also talk about what we as nurses can do and what is our role in recognizing and addressing racial biases as well. Well, ANA is committed to this work, and our code of ethics demand that we do no less. As nurses, we all know that we accept people for who they are. The code calls on us to recognize human dignity regardless of race, culture, creed, sexual orientation, ethnicity, gender, age, experience, or any aspect of identity. It beckons us to protect human rights and to reduce health disparities. Additionally, our code of ethics for nursing also defines advocacy as the act or process of pleading for, supporting, or recommending a cause or course of action. So at ANA, we believe that advocacy is a pillar of nursing, as I stated earlier. And also, as I stated earlier, we instinctively advocate for our patients, mostly in the acute care setting, but advocating for them out in the community and becoming politically savvy is just as important as than what we do in the work environment as well. We must not forget that the profession was founded and evolved through political action and strong advocacy. Advocating for the profession, the healthcare consumer, and communities that we serve is not optional. It's a part of nursing's genetic code and makeup as well. As nurses, we must find our voices, particularly during times like we're facing now. The act of caring requires intentional action and advocacy. Lack of action in the form of silence, as I stated earlier, indicates complicity. So the flame that you're seeing here in this professional nursing model represents caring, values, wisdom, and energy with ethics as the base. Caring is being called out here as a basic tenet of the profession that is inherent in every nurse. Every caring relationship from a nurse must start with respect for the autonomy and the right of the healthcare consumer. The values component of the flame that is listed here represents respect, inspiration, and empathy. Overall, respect is about the importance of relationship, service, willingness to bear witness, self-determination in the pursuit of health. Respect does not occur without dignity, and the backbone of dignity is mattering. Mattering is an ideal state of two complementary psychological experiences, feeling value and adding value. Human beings can feel valued by and add value to themselves, to others, work in the community. And to make sure that the need for mattering is fulfilled, we must balance feeling valued with adding value. Moreover, nursing, one of the most selfless professions in the world, has a duty to strive for a counterbalance of caring for self as well as caring for others as well. As nurses, we can continue to add value by understanding the critical role or our critical role in addressing equity. Equity falls within a continuous range of ethical issues or dilemmas that nurses face on a daily basis. There is that distrust of the healthcare system. We know that America's longstanding history of racism and discrimination across our society and within our healthcare system has caused some people to be distrustful of our healthcare system. Decades of mistrust has exacerbated preventable chronic health conditions, maternal death rates, and more in these communities because they don't feel that their voices are being heard or that they will receive the proper care. So as a result, many don't seek the timely health care or don't have the tools or the resources or the education to live a healthy life. We're seeing this play out now in the COVID-19 crisis, where the disproportionate impact, as we talked about, and deaths were primarily in the Black and Brown communities, and they were disturbing numbers. So we must put in place solutions now if we want to have a fighting chance at rebuilding that trust. Being representatives of communities that we serve is so important. I made it as one of my goals to be actively recruiting that we get more men and more people of color into the nursing profession, because again, as I just stated, I believe it is extremely important that we represent the communities that we serve. So what can we as nurses do to begin tearing down the walls of racism? Well, the first thing is to use your voice and influence to educate others about systemic injustice, health inequity, and health disparities. You can educate yourself and then use your trusted voice and influence to educate others about the systemic injustices that have caused protests and riots and everything else that's being covered in the news. Listen, and not just listen, but actively listen and engage in dialogues with others. Be aware of your own unconscious bias and stand up for inequities and call it out whenever you see it. It will truly make a difference. Now, ANA recognized the progress in most national efforts to eliminate discrimination associated with race, gender, and socioeconomic status. However, concerted efforts must continue for discrimination to be eliminated in all forms. ANA recognizes impartiality begins at the level of the individual nurse and should occur within every healthcare organization. All nurses must recognize the potential impact of unconscious bias and practices that contribute to discrimination, and actively seek opportunities to promote inclusion of all people in the provision of quality healthcare while eradicating disparities. ANA supports this policy initiative that was directed toward abolishing all forms of discrimination. Actually, in 2021, we released the latest edition of our scope and practice standards. And in that latest edition, we insisted on a departure from the traditional educational requirements of cultural competency training. We argued that as a process or journey must be embarked upon for lifelong learning. This journey is a deep understanding that informs acceptance of others, which is not easily achieved through a reductionist method of reading a few paragraphs about those who differ in their background and their experiences. We propose a long-term learning investment to achieve deepening cultural humility, which is an endless commitment to learning to inform and continuously reshape our worldview. This will pave the way for harmony, grace, and understanding towards each other and those that we serve and care for. So ANA has prioritized caring for nurses during a frustrating and scary time for healthcare workers. So from safe staffing to mental health and well-being, to workplace violence, to racism, to removing nursing hours from being captured in room and board, to climate change, we fight for you. We assemble, learn, and scan, and then act through advocacy and awareness as well. We know that BIPOC nurses have a higher likelihood to contract COVID-19 and experience financial implications during this pandemic compared to their white counterparts. And though the Pulse of the Nation's Nurses Survey series that I mentioned earlier, we learned that BIPOC nurses were also less likely to seek out professional mental health support. All this on top of growing concerns of what we call racial battle fatigue. Racial battle fatigue is a theoretical framework that addresses the psychological and physiological strain exerted on racially marginalized groups and the amount of energy lost or dedicated to coping with social microaggressions and racism. Where racial battle fatigue goes untreated or dismissed, this stress-related psychological and physiological disease can be very lethal and can kill gradually and stealthily through hypertension, poor health attitudes, and behavior. So it's extremely important that we recognize that and begin to address it. And we know that the National Academy of Medicine, it should be the National Academy of Nursing, but anyway, it's my own thing there. But the National Academy of Medicine released its long-awaited report The Future of Nursing 2020-2030, A Path to Achieve Health Equity. The vision of that focuses on current and future challenges that are impacting the nursing workforce, its leadership in education in order to reduce health disparities and to address social determinants of health and advance health equity, which aligns very much with what we are hearing from nurses and what ANA is striving to address as well. Significant work is already underway with the enterprise, ANA enterprise, to align with these goals and to achieve objectives to help shape the future of nursing practice and health care. So we will continue to drive and follow those recommendations from the future of nursing. But to recap and wrap up, and I think we may have time for question and answers, ANA is committed to implementing a comprehensive strategy to address inequity. As nurses, we must continue to take action to advocate for, one, a commitment to social justice and health through actions and advocacy to address the social determinants of health and to promote well-being in every zip code. We must continue to take actions and advocate for just systems and structures by using our voice to drive transformative, action-oriented policies and address inequities and promote social justice. We must continue to take action and advocate for professional nursing organizations to actively engage in the political process, particularly those that address public health and the profession of nursing. We must continue to take action and advocate for the advancement of a nursing agenda for the overall health and safety of the public. And finally, we must continue to take action and advocate for an upending of the roots of structural inequities and social injustice in healthcare. So the path that we have tread has been a long one, but there is still work to be done. And I hope that you will join me on this path to ensure that the nursing profession is representative of everyone, of all the people that we serve. So I want to thank you for the opportunity to speak with you today, and I hope that you will have the opportunity to stay engaged with us as we continue this work. And I would welcome I think, will we have time for questions? So I welcome the opportunity to answer some questions for you. So thank you. Don't be shy. I'm not. Okay, somebody's got to break the mold. Not even somebody get up there and say, "What's it like being the first male president?" Thank you. So what's it like being the first male president? As I told the Beth and some of the group this morning, I realized that when I was elected, that I was going to be under the microscope. There's the old protective thing, if you will, that is he doing this right? Is he doing that right? Or whatever. So far, I think not patting myself on the back, but I think I did a pretty good job. But I have a wonderful support team. I really do, because it's all about teamwork. Just as your team here recognize who you are and what you do and the vital role that you play. I recognize the folks who are behind the scene, even though I'm up front, they make me look good, but I also have to reach back and thank them for every little thing that they do. And it's all of us working together. So, who would have thought that a pandemic would come along? The only other person that's experienced this was the person who was president during the Spanish flu. And I went back and looked at her record. She was a retired Army nurse. So she had everything just down pat, because the Army knows how to get things done. And that's what we do, is follow their recommendation. And that's how we got through the Spanish flu. Fast forward to today, obviously things are a little bit different, increased technology and et cetera. But it has worked very, very well to be able to do that. And it's a joy to blaze the trail for other men. I hope that there's not another 126 years, or at the time I was elected, 122 years had passed. So I hope there's not another 122 years before another male will introduce himself as the president of the American Nurses Association. So now that I've broken the ice, any other questions? Yes. How ANA has supported nursing home nurses. Well, not only just nursing home, but also just nurses in general. We have, again, part of it advocating up on the Hill, letting members of Congress know the funding and stuff that we need, but then also assisting them with trying to set up guidelines and things like that for nurses who are there at the bedside. One of the unique things that I've done, I have 40 nurses around the country that I speak to that are in all levels of nursing. They're at the bedside, they're in education, they're in long-term care, they're in public health, and et cetera. I want to know what's going on at the grassroots level. So when I called them up and said, hey, do you mind if we have a conversation at least once a month? First of all, they thought I was joking. And I'm going, no, I'm serious. I want to know, because if something's happening at the grassroots level, I want to know about it there before it becomes, a big thing that perhaps we may have to look at. So some of those that are within long-term care, yes, we begin to address those issues. When you see, obviously, when COVID first happened, it was a lot of senior citizens who were dying as a result of that. And, what steps do we need to take? So by providing, the education for them, on how to, pay particular attention to those senior citizens, really helped quite a lot as well. Setting up guidelines and things along that way is some of the things that we have done and continue to do. Yes. Mm-hmm. Yes, if you go on the website now, ANA put out its statement, its position statement on a woman's right to choose. And then we're waiting until the official verdict comes down from the Supreme Court to issue some additional statement. But we are standing by that long-held position statement of a woman's right to choose. Yes, ma'am. Yes. I certainly hope not. I think given the last 2+ years, if those who control the purse doesn't realize the power of nurses and who we are and what we do, that there is, I always say, without nursing, there is no health or health care. So I think they have been awoken, maybe, to realize that the funding that needs to be done and needs to be there, but not only for nursing but for healthcare in general. It's to me it's a no-brainer. That we really need to pay attention and put more. To me, an ounce of prevention is worth a pound of cure. So if I put more money towards prevention and doing, consumer education and, things of this sort that would make them, be more healthy. Things like, instead of a clinic being open from Monday through Friday, 9 to 5, that person who has to make a decision, can I afford to take a day off from work, first of all? Number two, can I afford to lose the money that I would make by skipping work to go see about my health, because I have to put food on the table or pay my bills, and I got to take 3 buses to get to the clinic. And when I get there, I may or may not be seen on time because they're running behind. You can see how that begins to snowball. So why can't we put enough funds in there to where that clinic can be open from 7 in the morning till 10 or 11 o'clock at night, which would allow that person to still do their 8-hour shift, but when they come off work, they can still see about their health. And that's a great way to be able to educate that person about, the stress and proper diet and things like that. Or you may be, pre-diabetic or, whatever else. They're going to be likely more to pay attention to you, realizing that, hey, I can still work and get money coming in, and I'm going to listen to this provider. But if I'm in a stressful situation where I've already, I'm missing a day's work, And now you're going to sit there and talk to me about a diet and, and everything else when I'm not going to have enough money to buy the food that you want me to buy. You see how that begins to create a snowball effect. So we really need to look at different ways of how we need to bring healthcare to the consumer, not consumer to the healthcare. We need to come into their community and say, what do you want or what do you need? And let's give you those resources there, and then begin to talk about, well, we have this program here that you may be interested in. Let them know that, well, establish that trust, I think, first, and then, work from there. Yes.
Hi, my name is Adeniki. I'm a nurse practitioner from Mount Sinai Morningside. Thank you, Dr. Grant, for being here, and thank you for your wonderful presentation. I do have a question. It was pretty shocking to see that statistic about 3 out of 4 nurses of color experiencing racism in the workplace, whether it's from patients, peers, or supervisors. So what are some recommendations you have about addressing racism in the current day on the units?
First of all, you need to call it out when you see it or hear it, or sometimes some of them could even be longtime friends and colleagues that you maybe have worked with for 10 to 15 years or so, and they may say something about someone who may be of the same ethnicity, but then they'll say to you, "Oh, I wasn't talking about you. You're different, right?" But when you say, "No, I'm not different," you're talking about my peeps, right? Get them to see that this is not right. The other thing too is to ensure that there are policies or guidelines in place, at the place of employment, that you're supported, that we will not tolerate racism. And and here is what you do when you see it, or how to go about reporting it, and knowing that you would be supported, from places like that, are the first couple of things to do. But we were talking this morning about your DEI team that you have here, and I'm really impressed with the work that they're doing. And as I was telling Beth, I'm actually going to call on them, because one of the things that I plan for ANA when we get this reckoning statement passed is to have ANA create an office of DEI that will begin to set the national standard for hospitals and nursing schools, so that at least we can have like a minimum standard. Anything above and beyond that is just icing on the cake. But we, everybody has their own DEI work that's being done. But if you look at one person's DEI is going to be different from this one and different from that one, we need to somehow find, okay, what's the foundational work that we need to do? So part of that will come from that. But immediately, that's just the first 2 answers that come to my mind, is to call it out and get that person to see, when you're talking about that person, just because they're from this zip code doesn't make them any less of a human being than if they're from that zip code. If you view that way, then you need to consider why you went into healthcare. Because if you go into healthcare to take care of your fellow man, that's your fellow man who was downtrodden, or that's your fellow man who lives in a big mansion as well. They all deserve the same treatment.
Thank you.
Thank you. Yes. That's why I have gray hair. I was telling some people when I first started 3 years ago, my hair was all black. And then when COVID came along, but I earned every strand, so that I view it as wisdom. But our stand is obviously try to figure out what it is that nurses need. When I speak with nurses every day, or I get emails and et cetera, I know they feel undervalued. They feel as if they are not being heard. And so we need to figure out, from them, because what may make you feel valued may be different from me. So trying to get, employers to understand that, and I'm sure you've all have heard it, the days of the pizzas and the cup of coffee and donuts, or even the movie tickets, that's over. What nurses need is to feel that their voices are being heard. And part of that could be that, let's, I don't know, talk to them. That's one thing. If you have town halls, keep them abreast of what's going on, how we are trying to fill vacant positions. And ask them, do you have any suggestions? Do you have any friends out there or whatever that could help us? When I was visiting some of the floors today and I hear that, people have been here, 20, 30, 40 years and et cetera, that's family. Those are people that are going to stay here no matter what, because they love what they do. They love the people that they work with. Those are the people that you need to talk to and say, what is it that keeps you here? Why do you keep, coming back day after day, even when we call you to say, can you come in and work an extra shift and et cetera? Obviously you're going to do it because of who you are, but then there's something else deep down. You are committed to the organization. But then you also need to talk to that person who's ready to leave and say, what is it that's making you leave? What can we do to improve so that the next person that says, I'm leaving, you can maybe give them an alternative to say, well, we're going to implement this new program. You may be interested in that, or something else that would keep them here. It's all about investing in your people and your resources. But like I said, yeah, those people who've been here long term, they're here for the long haul. And those people who truly are committed and they are family, and you need to treat them like family. And that means, sitting down and having those honest conversations and listening to them. Like I said earlier, actively listen. It's one thing to listen, it's another thing to actively listen. And then say, so what I'm hearing is, for clarification. And if that's not what that person is talking about, then say, what do you mean? Please explain when you say this or that. So, yes. Mhm. Mhm. Thank you. Mhm. 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 Yeah. Awesome. Mhm. To kick it off. Mhm. 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 Yes. Mhm. Mhm. Yeah. Mhm. Yeah. Or afraid. Yeah. Mhm. Yeah. Great. Mhm. Mhm. Absolutely. Absolutely. You have my endorsement. Yes. I endorse. NAR. All right. Thank you. Thank you. Thank you. Yeah. That's great. That is great. Okay, awesome. Yes, looking forward to it. Thank you. I think there's someone back here.
Hi, Dr. Grant. My
Hi.
name is Jeremy. I'm from Mount Sinai, Queens.
Mhm.
Thank you for the presentation about the racism in nursing. My question is, ever since the COVID-19 outbreak panned out, a big like racism towards the Asian community. What is ANA doing for, like, have they released a statement in regards to the xenophobia regarding Asian communities, and what any advice to further, like, no, like the statement regarding Asian communities and
Yes, we have released a statement, and then also part of the work of the commission to address racism in nursing. There are 36 nursing organizations that are a part of that commission, of which, there's Asian American, there's the Filipino Nurses Association, Asian Pacific Islanders, Native American, it's just about every nursing organization that's out there that represents a minority culture are a part of that as well. And they have all lend their voice to the work that the commission is doing. So I think when the report comes out, if you take the opportunity to download it and read it, you'll see some of the work that is being done there as well. But yes, when we first were beginning to hear that there were attacks on the Asian Pacific Islander community, we did issue a statement against that, and calling on for all nurses to unite, because we're all in this together. It doesn't the fact that you have RN behind your name, or even LPN or LVN behind your name, we're all in the family. And the way I see it is, an attack on one of us is an attack on all of us. So we have to stand together to to beat this down. Otherwise, we're going to let those bullies out there think that they have the upper hand. And I'll just say it plainly, not on my watch. So that's what we really need to do.
Thank you.
Thank you. Yep. Okay.
So first of all, I want to thank Dr. Grant for that very informative and inspirational talk. On behalf of the Mount Sinai Health System, thank you for taking time out of your very busy schedule to be here with us in person to kick off the Nursing Week events. Today and every day, we recognize the nursing community for its tremendous contributions to our health system and beyond. Not only do nurses, and I apologize, 4.3 million, provide care to billions of people around the world, you contribute well beyond healthcare systems to the communities where we live, worship, and serve. Your leadership and innovative mindset make nurses vital to moving healthcare forward. Thank you for the incredible work that each and every one of you do every day for our patients and for our community. I'd like to invite everybody up after to join us for a reception in the 7th floor atrium. But before we do that, we want to give Dr. Grant, want to present him with a plaque for the Mount Sinai Health System to thank you for speaking at our 2022 Nurses Week event.
Who's the official photographer? She's
all right, Hanukkah.
We're still counting.
All right, tell him what you're
Let me
doing.
tell you, there's a little joke here. When she came in this morning and asked if she could start taking pictures, I said yes, but there's $50 for every click that you do, because I've got to contribute to the Ernest Grant retirement fund. And so right now we're a little over 400 clicks.
Yeah.
So it's not bad. Yeah. So I'll have a pretty nice retirement fund once that gets going.
Great.
So
Thank you. Thank you
Okay,
so much.
thank
So
you.
please join us on the 7th floor. Thank you.